See, the human biological clock or circadian rhythm is an internal 24-hour cycle that regulates various physical, mental, and behavioral changes. This rhythm, driven by a master clock in the brain, it's called suprachiasmatic nucleus, SCN. This influences the sleep-wake cycle, hormone release, body temperature, and all other physiological activities. Our sleep, our wake, our activities always in coherent with the circadian rhythm. Next, we'll say what is biological clock. This is a system that regulates in a organism initial sense of time and control of circadian rhythm. It composed of a protein encoded by thousands of genes that switched on and switched off for the specific order. There is a light enters from the through your retina, through your eyes, optic chiasma, then it reaches the circadian canal. So this biological setting are determined by the specific gene. These gene setting may be affected by the body temperature, BP, activity level, inflammation, fertility, mood, and brain functions. Even the timing of health and related events can be related to your biological clock. Next. What is master clock? In human, master clocks exist in the brain. The human master clock is in a large group of nerve cells that structures called suprachiasmatic nucleus, SCN. Among all the other functions, the SCN control the production of melatonin based on the amount of light that eyes received. In the evening, at the sunset, a person, when a diminished light to the eyeball, it enters into the retina, then it reaches the suprachiasmatic and tells the brain to stop, make the metabolism of the melatonin. Next. So when it developed, how it developed? Development of circadian supplies occurs in mammals postnatally. நம்ம ஃபீட்டஸில் இருக்கும்போது சர்க்காரின் கடல் வந்து ஸ்டிமுலேஷன் இருக்கவே இருக்காது. ஏன்னா இட் இஸ் நாட் சப்ஜெக்டட் டு எனி ஸ்டிமுலை. When a neonate is born with an immature functional system only, that will not have circadian clock. Only after 4 months only the circadian rhythm is developed. அதனால தான் இந்த குழந்தைங்கெல்லாம் 1 month 2 months நியூனேட்டில் இன்ஃபண்ட் எல்லாம் எந்த டைம்னாலும் தூங்கும், எந்த டைம்னாலும் எந்திரிக்கும், எந்த டைம்னாலும் ஃபீட் பண்ணும், பட் இட் வில் பி ஹாப்பி. நெக்ஸ்ட். What is the influence of a sun or moon in the rhythms? Naturally, daily the rhythm are synchronized with the sun. The master clock in the brain receives a direct input from the eye and coordinate with all clocks in the body. What is all clocks in the body? Every cell has got a clock. When to act, when to not act, when to sleep, when to regenerate. Every cell. Same time, the clock also synchronizes with the cells. During the daytime, it sends signs to the brain region, make normal, that will keep you awake, boost your heart rate, give you energy. Light கண்ணுக்குள்ள போக தான் நமக்கு எனர்ஜி வரும். So in the evening, when there's less light, enters nice, it triggers the production of the hormone called melatonin. It is secreted in the pituitary gland, pineal gland, and make you feel dusky and you stay asleep in the evening after 6 o'clock. Next. This is what light cycle and dark cycle. When you see the light cycle, it is bright throughout the day, and after 6 o'clock, that will be dark. This circadian can be influenced by food intake, கண்ட நேரம் சாப்பிடுறது not at the time of what we should eat. Then stress make wake or deep sleep. So இது ரெண்டுலையுமே affect ஆகும். Physical activity, less activities induces more sleep. Active persons always active and sleep at a time. When there is a temperature that regulates in the body, and it will affect the circadian rhythm. Travel, there's a jet lag. When you're going left east to west or south to north, there is a jet lag, and it will alter the circadian rhythm. When certain medications, especially psychiatric medications, also alter the circadian canal, and the mental health also play a vital role. This is because of the circadian rhythm is not maintained. Then injury brain or brain health condition, and poor sleep habituals, and overnight off work and work shifts. This also affect the circadian rhythm. Next. What is the impact of circadian rhythm on the health? Sleep is essential to regulate all our activities. When it is not regulated, it will act on the metabolic system, and significantly it produces the diabetic mellitus. Even circadian misalignments associated with various mental health, depression, and anxiety. The hormone also irregularly secreted. This will impact all metabolic activity and cognitive functions. Circadian rhythm influences the cognitive performances, alertness, the quality of speech, the reception of speech, and expression. Next. What is the functions of the circadian? This is sleeping, waking up, core body temperature, activate the immune system, and regularize the hormone. The sleep hormone is melatonin, the wake hormone is cortisol, and love hormones is oxytocin, and it also governs the cognitive function and the body reaction to the stress. Next. How it works out. When a night and darkness, when darkness enters into your retina, there is a retinal ganglion that inhibits the suprachiasmatic nucleus. Once the new suprachiasmatic nucleus is inhibited, it activates the preventricular nucleus, and this preventricular nucleus in turn sends oxon through the mediolateral nucleus that reaches the sympathetic nervous system and increases the sleepiness. So sympathetic nervous system is very important for inducing sleepiness. Next. What will happen when there is a misalignment? When circadian misalignment leads to hypertension, hyperglycemia, hyperlipidemia. That is insulin resistance and slow ST. Night there will be insulin resistance, and there is not a secretion of insulin at all in the night. That's why we will ask to take only a smaller amount of carbohydrate in the night. Then abdominal obesity is very common. This is a disrupt and pro-inflammatory state. There's increased risk of obesity, diabetes, and cardiovascular diseases. Next. There is a time where our every organs are functioning optimally. When you see it 3 o'clock to 5 o'clock, lung is very active in time. This is the time where we are sleeping deep sleep, dreams will come, and memory power is increased, and there is a detoxification in your body. This is early in the morning, And the 5 to 7, large intestine is active. There is a relaxation of bowel. After relaxation, you can sit and meditation, the ideal time for sitting, meditating, and doing yoga. Between 7 and 9 o'clock, stomach is active. That's a time for breakfast. 9 to 7 and 7 o'clock, you can go for a walk. You can concentrate certain things and you can give a speech on that time also. That is the time for the breakfast. 9 to 11 is the time of the split, where there is a clear thinking and food and energy is created at the time. There is assimilation also. And 11 to 1 p.m., heart is functioning. There's blood circulation is higher level. There is high energy. And there is clear thinking and carving for the food. And there is 1 to 3 p.m., there's a small intestine is active, where it sort out all our food absorbed in the morning, and it is absorbed and assimilated. And this is a time where we have to take a lunch, and after lunch, there need in a lab, smaller nap is always encouraged. The 3 to 5, the bladder is working. There is energy restoration at the time of things, and there is a liquid in the body is released. This is a time where you can work, you can study, you can play. And 5 to 7 p.m. kidney is very active. It is a time for reading, relaxing time, and you can see all other activities also. Then 7 to 9, pericardium is active. It is a time for your protection and your light dinner. And 9 to 11, there's a triple banner. The endocrine is more active. Metabolic balance is acting. So it induces all our activities in the abdomen, and the digestive system is acting. And the time for getting sleep, where this is a time where there is melatonin optimum in your blood level. And 11 to 1 is gallbladder time, where gallbladder is biles are released. There is cellular repair. There is blood flow cells or cellular repair, especially the brain cells and the RBCs. And 1 to 3, liver is always very active, where we should give a deep sleep, and there is a detox in the blood. There is a rest of the brain and recovery of the brain. This is a time for the planning. Even the brain started planning at the same time. So breakfast should be between 7 and 9. Lunch should be 1 and 3. And dinner should be 7 and 9. And after that, there should not be any food at all. It is better to take last meals at 7:30 or 8. Next. And when we follow this schedule, will not get hypertension, will not get diabetic, will not be obese. Circadian and the modern life, how it affects, modern life affects circadian. There are technical influences. Use of electronic devices before bedtime can interrupt circadian rhythm due to blue light exposure and make it harder to fall asleep. Always, when you go to the bed, we are previously we are sitting and reading. Nowadays, reading on the cell or the laptop. So this blue light always hinted the sleep. And this sleep is not proper at the time. Then shift work and challengings. Individual working non-traditional work may struggle with the circadian misalignments, leading to increased health risk and degrees of productivity also. So shift workலையும் ப்ரொடக்ஷன் நல்லா இருக்காது, நைட் முழுக்க முடிச்சுட்டு இருப்பாங்க. But it is a public health impact. Understanding and addressing the circadian rhythm is essential for public health strategies aimed at reducing the impact of the sleep-related disorder and improving population health. So adopting a circadian rhythm is essential for a better life. Next. Strategies for rhythmic regulation: light exposure in the morning, maximize the natural light during the daytime, minimize the artificial light at the night, helps to regulate the circadian rhythm. Second, consistent sleep schedule. Maintaining regular sleep schedule improve the quality and the support of natural rhythms. Healthy lifestyle choice is balanced nutrition, regular exercise, and stress management help to maintain healthy circadian rhythm and healthy life. So based on this, I think it is better we think twice. First, we should adopt, and we should advise our patients also. So thank you very much. Thank you, Pradeep.
Yes, sir, that was wonderful, sir. So even in spite of your small surgery, minor surgery, you were always thinking about IMA Nalamdana, sir. And it shows in your commitment. Well prepared slides, sir. So the floor is open. If anybody has any doubts, you can just unmute yourself and ask. We'll have a 2-minute discussion, following which Dr. Keerthi will be talking about her topic of breathing for stress relief.
I made this presentation very small because I want everybody to participate in the discussion.
Mainly about that screen usage, what you said, sir, that holds true even in children, because we see all our kids are constantly glued. Even in the night time, they are using that.
Yeah.
And what you mentioned about that melatonin and how it affects the circadian rhythm, I think it's for all of us. So anybody wants to ask any doubts, you can unmute yourself and you can talk now, or you can put it in the chat box also.
Doraikannan, sir, very wonderful presentation, sir.
Thank you.
Sir, this circadian rhythm very much important for our profession, because almost 50% of our profession, that is both medical and paramedical, they are doing night shifts. So we must devise or design a protocol on how to overcome these circadian rhythm related issues. So we can give an outline, even give a thing to the government on how we should take care of the mental health through this maintenance of the circadian rhythm, because almost everywhere in Tamil Nadu, the night working is there, not only in our profession, in other professions also. So we should do something about this, sir.
Actually, I took this topic only to sensitize doctors only first. Even if you are in a night shift or a day shift, at least taking meals at a proper time may reduce the stress. Sitting, working, not taking food or not taking anything, seeing where slides, it kills the persons. So we should everything, as you said, well, sir, we should take care of ourselves first, then we can preach.
So if there are no other queries,
sir,
we will move on to
taking beverages like coffee affect circadian rhythm?
Yes, sir. Any coffee, alcohol, or any stuff, it will affect circadian rhythm. And everyone should have a time. எப்போ காஃபி கொடுக்கணும், நைட்டில் படுக்கும்போது காஃபி குடிச்சு படுத்தா கண்டிப்பாக இட் இஸ் ஸ்டிமுலன்ட், அந்த மாதிரி டைமில் இருக்கும். ரிப்பீட்டடாக காஃபி கொடுத்து பழகிட்டோம்னா உங்களுக்கு அப்டாமின்லேயும் கெட்டும், ஃபர்ஸ்ட்டில் சரி பண்ணிடும். தெர் மே பி gastritis, that will not, absorption is not there. Any stimulant other than that, நீங்கள் காஃபி டைமில் காஃபி குடித்தா ஒன்றும் பிரச்சனை இல்லை. காலைக்கு பிரேக்ஃபாஸ்ட் முடிச்சு ஒரு காஃபி குடிக்கிறீங்க, இல்லை ஈவினிங் ஒரு டீ முடிச்சு ஒரு காஃபி குடிக்கிறீங்க, that will not affect your routine rhythm.
Are there any more questions? So we'll be moving on to the next topic by Dr. B.M. Keerthi.
Thank you, Pradeep. Thank you. Welcome, Keerthi madam.
Thank you, sir. So we all know Keerthi ma'am as an active member of our IMA Nalamdana group. She's finished her diabetology nutrition course, and also she has finished a palliative care fellowship. So ma'am is currently the secretary of Chayar branch of IMA. Over to you, ma'am.
வணக்கம். So sir ஓட circadian rhythm presentation was very super. நான் வந்து இப்ப ரொம்ப வளவலன்லாம் பேச போறது இல்ல. ஸ்ட்ரெஸ் ரீஸ்ட்ரெஸ் பண்றதுக்கு நம்ம என்ன டெக்னிக்ஸ் ஃபாலோ பண்ணலாம். I've chosen breathing exercises or breathing techniques. So ஏன் breathing techniques? Why breathing techniques? So next, I cannot move.
Ma'am, I am presenting here, ma'am.
Yeah.
So you want to present?
Yeah.
Then you have to take host, ma'am. I'll stop sharing. You can just share your screen.
Yeah, I'll let you. Yes. So is it visible, sir?
Yes, ma'am. Please present, ma'am.
Am I audible, sir?
Go to slideshow and click on slideshow, ma'am. Yeah, ma'am. Yeah.
Yes. So why breathing exercise? So breathing exercise, we don't want any aids or instruments or any extra fitting la edhum thevilla. So we can do breathing exercise at your comfortable level la pannalam. Idhula breathing exercise pannadukku apparama edana pain varapodha, tiredness varapodha na no, pharmacologically illa, non pharmacological. So anytime any place comfortable breathing exercise pannalam. Side effects kadayadu. It is going to be very simple and easy. And time consuming kadayadu. You can start from 1 minute, 3 minutes, and you can extend up to 10 minutes or 15 minutes. Depends upon your time. It can be combined with any treatment protocols. Unless surgeries and the madri edhum illa, abdominal surgeries, cardiac issues and the madri, you can combine with the normal diabetic irundhalum pannalam, hypertensive irundha pannalam. You can combine with any treatment protocols. Adukapra what all the changes happens when you do breathing exercise na respiratory la, or any breathing exercise vandu it is going to improve your lung capacity, especially the diaphragmatic breathing la physios will be doing it in the hospitals, pre-op, post-op alla physios will be physiotherapists vandu patients ku they will be doing it. Adula what happens in slow and deep breathing la enna aguna, alveolar ventilation will be improved, oxygen saturation improve pannum, and respiratory rate reduce pannum. So tidal volume will be increased. So total lung improvise pannadu, work of breathing improvise pannadu, strength of the respiratory muscles vandu like diaphragm and intercostal muscles strengthen pannadu. Cardiovascular la low blood pressure create பண்ணுது. breathing exercise நம்ம ஃபாலோ பண்ணனா பிபிஎல் லோ பண்ணுது, ஹார்ட் ரேட் லோ பண்ணுது. அதனால பாராசிம்பத்தட்டிக் நர்வஸ் சிஸ்டம் ஆக்டிவேட் பண்ணுது, சிம்பத்தட்டிக்க காம் டவுன் பண்ணுது. லைக் ஃபைட் டு ஃபிளைட் மோட்ல இருந்து இட் இஸ் ஷிஃப்டிங் டு ரெஸ்ட் டு டைஜஸ்ட் மோடுக்கு போகுது. கார்டிசால் லெவல ரெடியூஸ் பண்ணுது. And respiratory sinus rhythms, like during inspiration heart rate will be increased, during expiration heart rate will be decreased. In the synchronization increase பண்ணுது. So HRV, heart rate variability will also improve. Due to diaphragmatic breathing மாதிரி சில types of breathing ல negative pressure create ஆகும்போது venous return to the heart வந்து increase ஆகிறதுனால increased cardiac outputம் கிடைக்குது. Same story அதேதான். ஃப்ரம் ஃபைட் டு ஃபிளைட் மோடுக்கு பிரீதிங் எக்ஸசைஸ் ஃபாலோ பண்ணா சிம்பத்தட்டிக் மோட்ல இருந்து பாராசிம்பத்தட்டிக் மோடுக்கு ஸ்விட்ச் ஓவர் ஆகுது. ஸோ பாடி ரிலாக்ஸ்டா ஃபீல் பண்ணுது. into a ரெஸ்ட் அண்ட் டைஜஸ்ட் மோடுக்கு ஷிஃப்ட் ஆகுது. ஸோ அதே மாதிரி கார்டிசால் லெவல்ல எல்லாம் லோ பண்றதுனால ஆன்சைட்டி, டிப்ரெஷன்லாம் வந்து ரெடியூஸ் ஆகுது. வேற என்ன எஃபெக்ட்ஸ் இருக்கும் எப்ப நம்ம பிரீதிங் எக்ஸசைஸ பண்ணலாம்னா, லைக் ப்ரியர் எக்ஸசைஸா பண்ணலாம், போஸ்ட் எக்ஸசைஸா பண்ணலாம், இல்ல டே ஸ்டார்ட் பண்ணும் போது பண்ணலாம், இல்ல டே எண்ட் பண்ணும் போதும் பண்ணலாம். ஸோ ரெடியூசஸ் லாக்டிக் ஆசிட் பில்டப், இம்ப்ரூவ்டு இம்யூன் சிஸ்டம் சொல்லலாம், எனர்ஜியும் ஸ்டாமினாவும் இம்ப்ரூவ் பண்ணுது. டைஜஷன் அண்ட் ஸ்லீப் இஸ் ஆல்சோ இம்ப்ரூவ்ட் வென் யூ டூ கண்டினியூஸ்லி த பிரீதிங் எக்ஸசைஸ். லைக் பார்ட் ஆஃப் யுவர் லைஃப் ஸ்டைலா நீங்க மெயின்டைன் பண்ணீங்கன்னா ஆல் திஸ் will happen. So breathing exercise are divided into evident scientific breathing exercises and yoga pranayamas, which is not very strong evident scientific basis நிறைய நம்மளுக்கு ஆன்லைன்ல கிடைக்கல. So I have divided like diaphragmatic breathing, abdominal breathing, first lip breathing, glossopharyngeal breathing we'll see in the hospital setup. நம்ம பிசியோதெரபிஸ்ட் வந்து ப்ரீஆப்போ போஸ்ட் ஆப்பா இல்ல ஐபி பேஷண்ட் ஓபி பேஷண்ட்ஸ்க்கே பிரிஸ்கிரைப் பண்ணுவாங்க. பிராணாயாமா பிரீதிங் வந்து கம்ப்ளீட்லி யோகா பிரீதிங். ஸோ டயப்ரமேட்டிக் பிரீதிங் எப்படி பண்ணலாம் ப்ராக்டிக்கலா பாத்துடலாம். சிட்டிங் ஆர் லையிங் பொசிஷன்ல யூ கேன் டூ டயப்ரமேட்டிக் பிரீதிங். ஸோ டயப்ரமேட்டிக் பிரீதிங் அப்போ வாட் யூ கோயிங் டு டூ, inhale through the nose by inflating the abdomen and exhale through the nose, again deflating the abdomen. இது பண்ணும்போது what happens, நம்மளுடைய லங் கெப்பாசிட்டி எல்லாம் இம்ப்ரூவ் ஆக போகுது. அண்ட் தென் ஸ்ட்ரென்தன்ஸ் டயப்ரம் இன்டர்காஸ்டல் மசில்ஸ். இதனால ரிலாக்ஸா ஃபீல் பண்ண போறீங்க. இது யாரெல்லாம் பண்ணலாம், யூ கேன் டூ, எனி ஒன், எனி நார்மல் இண்டிவிஜுவல் கேன் டூ. ப்ரீ ஆப்பா பண்ணலாம், போஸ்ட் ஆப்பா பண்ணலாம், ஈவன் பிரெக்னென்ட் விமன் பண்ணலாம், ஓல்டர் ஏஜ் குரூப் ஆர் பீடியாட்ரிக் யார் வேணாலும் டயப்ரமேட்டிக் பிரீதிங் பண்ணலாம். இட் இஸ் ஆல்வேஸ் பிரிஸ்கிரைப் டு த பேஷண்ட்ஸ் ஆல்சோ. இதனுடைய மாடிஃபைடு வெர்ஷனா நம்ம இந்த இன்சென்ட்ரிக் ஸ்பைரோமெட்ரி எல்லாம் பார்க்கலாம். கோவிட் டைம்ஸ்ல ஆல்மோஸ்ட் எவ்ரி ஹவுஸ் ஹோல்ட் ஹஸ் ஸ்பைரோமெட்ரி. அப்புறம் ஃபர்ஸ்ட் லிப் பிரீதிங் வந்து சிட்டிங் பொசிஷன்ல வாட் யூ ஹேவ் டு டூ, இன்ஹேல், நார்மல் இன்ஹேல் த்ரூ த நோஸ். எக்ஸேல் வந்து எப்படி பண்ண போறீங்கன்னா த்ரூ த மவுத் யூசிங் பவுட் மவுத், இன்ஹேல் எக்ஸேல். இது ஃபர்ஸ்ட் லிப் பிரீதிங். இது சைக்கிள் வந்து ரிப்பீட் பண்ணலாம். ஸோ எந்த பிரீதிங் எக்ஸசைஸ் பண்ணாலும் டயப்ரமும் இன்டர்காஸ்டல் மசிலும் வந்து ஸ்ட்ரென்தன் ஆக போகுது, லங் கெப்பாசிட்டிஸ் வால்யூம்ஸ் இதெல்லாம் இம்ப்ரூவ் ஆக போகுது. இந்த ஃபர்ஸ்ட் லிப் பிரீதிங் யூ கேன் ஆல்சோ ரெக்கமெண்ட் டு த பேஷண்ட்ஸ். யாருக்கெல்லாம் பண்ணலாம்னு பாத்தீங்கன்னா சிஓபிடி பேஷண்ட்ஸ்க்கு, ஆஸ்மா பேஷண்ட்ஸ்க்கு எல்லாம் யூ கேன் ரெக்கமெண்ட் ஃபர்ஸ்ட் லிப் பிரீதிங். glossopharyngeal breathing, frog breathing சொல்லுவாங்க. again you can do it in the sitting posture. இதனோட ஸ்பெஷாலிட்டி என்னன்னா, இது ஸ்பைனல் கார்டு இன்ஜுரி இருக்க பேஷண்ட்ஸ்க்கு நீங்க பிரிஸ்கிரைப் பண்ணலாம். போலியோ பேஷண்ட்ஸ்க்கு, மஸ்குலர் டிஸ்ட்ரோஃபி இருக்கிற பேஷண்ட்ஸ்க்கு நீங்க பிரிஸ்கிரைப் பண்ணலாம். நம்ம எப்படி பண்ணலாம், how you can do. so take a gulp of air, slowly push into the lung. Gulp, close your mouth, push your tongue and then push the air into the lung. so வாயில ஒரு gulp ஏர் எடுக்க போறீங்க, வாயை க்ளோஸ் பண்ண போறீங்க, டங்க் வச்சு புஷ் பண்ணி ஏரை லங்குக்கு சென்ட் பண்ண போறீங்க. ஸோ இதுதான் glossopharyngeal breathing. இது வந்து மசில்ஸ், ஓரல் மசில்ஸ்க்கு எல்லாம் ஸ்ட்ரென்தன் பண்றதுக்கு, அகைன் ரெஸ்பிரேட்டரி மசிலும் ஸ்ட்ரென்தன் பண்றதுக்கு, வைட்டல் கெப்பாசிட்டி இம்ப்ரூவ் பண்ணும், இம்ப்ரூவ் ஸ்பீச் அண்ட் அந்த மியூக்கஸ் கிளியரன்ஸ்க்கும் இது ஹெல்ப் பண்ணும். இப்ப நான் வில் கோ டு த யோகா. யோகால பிராணாயாமான்னு சொல்லக்கூடிய பிரீதிங் இந்த சீரியஸ்ல தான் யூஸ்வலி பண்ணுவோம். லைக் கபாலபதி, அதுக்கப்புறம் பஸ்திரிகா, தென் நாடி சுத்தி, அகெயின் பிரம்மரி. இந்த ஆர்டர், இந்த சீக்வன்ஸ்ல தான் நம்ம பிராணாயாமா பண்ணுவோம். ஸோ பிராணாயாமால இப்ப நம்மளுடைய பிசியோ பிரீத்திங் வந்து எனி டைம் எனி டே அந்த மாதிரி நம்ம ஈஸியா சொல்லிடலாம். பட் பிராணாயாமால வாட் யூ ஹேவ் டு டூ, ஒன்னு ஏர்லி மார்னிங் பண்ணுங்க, இல்ல ஈவினிங் பண்ணுங்க, இல்ல சாப்பிட்டு ஒரு 2 hours லேட்டரா பண்ணலாம் இந்த பிராணாயாமா பிரீதிங்ல. சோ கபாலபதின்றது ஸ்கல் ஷைன் பிரீதிங்னு சொல்லுவாங்க, பிரெத் ஆஃப் ஃபயர்னு சொல்லுவாங்க. நார்மல் சிட்டிங் பொசிஷன்ல இன்னேல் நார்மலா எடுத்துட்டு குயிக் எக்ஸேல் பண்ண போறீங்க, ஃபோர்ஸ்ஃபுல் எக்ஸலேஷன் பண்ண போறீங்க, அப்டமன் கான்ட்ராக்ட் பண்ணிட்டு. இன்னேல், திஸ் வில் பி த கபாலபதி. ஸோ இன்னேல் நல்லா நார்மலா எடுத்துட்டு எக்ஸேல் மட்டும் குயிக் அண்ட் ஃபோர்ஸ்ஃபுல் பை கான்ட்ராக்டிங் த அப்டமன். ஸோ இதனுடைய பெனிஃபிட்ஸ் பாத்தீங்கன்னா ரெஸ்பிரேட்டரி ஃபங்க்ஷன் தான். ஸோ நான் சொன்ன மாதிரி எல்லாத்தோட பிரீதிங் எக்ஸசைஸோட பெனிஃபிட்ஸ் வந்து ஆல்மோஸ்ட் சேமா தான் இருக்க போகுது. இண்டிகேஷன் எனி நார்மல் இண்டிவிஜுவல் கேன் டூ. பட் யோகான்றதுனால அவங்க தே வாண்ட் டு ரெஸ்ட்ரிக்ட், ரொம்ப பிளட் ப்ரெஷர் அதிகமா இருந்தா வேண்டாம், ஹார்ட் கண்டிஷன்ஸ் இருந்தா வேண்டாம், ஹர்னியா, டிஸ்க், ஸ்லிப் இருந்தா, ரீசன்ட் அப்டமினல் சர்ஜரிஸ், பிரெக்னன்ட் விமன்ல கபாலபதி அவாய்ட் பண்ண சொல்றாங்க. ஸோ பெலோஸ் பிரீதிங் ஆர் பஸ்திரிகா, இது சிட்டிங் பொசிஷன்ல பண்ணலாம். இட் இஸ் ரேபிட் ஃபோர்ஸ்ஃபுல் இன்ஹலேஷன் அண்ட் ஃபோர்ஸ்ஃபுல் எக்ஸலேஷன் தான் பஸ்திரிகா. இது வந்து சைக்கிள் வந்து எத்தனை தடவைனா, யூ கேன் ஸ்டார்ட் ஃப்ரம் 1 minute, அப்புறம் ப்ராக்ரெசிவா பண்ணும்போது யூ கேன் எக்ஸ்டெண்ட் டு 3 minutes வரைக்கும் பண்ணலாம். பெனிஃபிட்ஸ் வந்து ஆல்மோஸ்ட் சேம் தான், நார்மல் இண்டிவிஜுவல் பண்ணலாம். அண்ட் கான்ட்ரா இண்டிகேஷன்ஸ் அதே தான், ஸ்லிப் டிஸ்க், வெர்டிகோ இருக்கு, ஹர்னியா இருக்கு, இதெல்லாம் பண்ணுவோம். ஸோ இட் வில் பி, இப்போ பஸ்திரிகா எப்படின்னா யூ ஹேவ் டு இன்ஹேல் ஃபோர்ஸ்ஃபுல்லி. This will be the Bhastrika, like inhale forceful and exhale forceful via nostrils. In the cycle, like 1 minute start பண்ணி you can extend up to 3 minutes. Okay.
Click on the screen and then trying with your right cursor.
Yeah. Okay. Nadi sutti or alternate nostril breathing. So இது வந்து what you have to do sitting positionல பண்ண போறீங்க. சுகாசனான்னு சொல்லுவாங்க. லைக் சப்பளம் போட்டும் உட்காரலாம் இல்ல பத்மாசன்லயும் உட்காரலாம். எந்த நீங்க breathing exercise பண்ணணும்னாலும். So what you have to do, ஒரு nostril using your thumb, ஒரு nostril close பண்ணிட்டு, like right nostril close with the thumb and left nostril is open. Take inhalation via the left nostril, then close the left nostril, then exhale via right nostril. இந்த சைக்கிள்ல திருப்பி அகைன் ஆப்போசிட் பண்ண போறீங்க. எந்த நாஸ்ட்ரல்ல நீங்க இன்ஹலேஷன் எடுத்தீங்களோ அதுல ஆப்போசிட் சைட்ல லைக் ரைட்ல எடுத்து அந்த சைக்கிள் முடிச்சீங்கன்னா அகைன் டூ இட் ஆன் த ஆப்போசிட் சைட். இது வந்து நாடி சுத்தின்னு சொல்லுவாங்க. So you can start from 1 minute, again push to 3 minutes slowly. Indication again same தான், பெனிஃபிட்ஸ் இருக்க போகுது. இண்டிகேஷன் அண்ட் கான்ட்ரா இண்டிகேஷன் வந்து சேம் தான் இருக்க போகுது. சரிங்களா? ஸோ இந்த எக்ஸசைஸ் வந்து டு பி வெரி ரிலாக்ஸிங். நீங்க ரெகுலரா பண்ணும்போது ஈவன் ஐவ் சீன் பேஷன்ஸ் டெல்லிங் மீ மியூக்கஸ் கிளியரன்ஸ் ஆயிட்டு ஹெட் ஏக்ஸ் எல்லாம் கம்மியா இருக்கு அண்ட் ஸ்லீப் இம்ப்ரூவ் ஆயிருக்குன்னு சொல்லிட்டு மோஸ்ட்லி இந்த நாடி சுத்திக்கு எவ்ரி பேஷண்ட் இருக்கு. பிரம்மரியும் அகைன் சிட்டிங் பாஸ்டர்ல பிரம்மரி வந்து யூ ஆர் கோயிங் டு கம்பைன் பிரீதிங் வித் த சவுண்ட் பிரம்மரின்றது. ஸோ வாட் யூ ஹவ் டு டூ, க்ளோஸ் யுவர் ஐஸ், க்ளோஸ் யுவர் இயர்ஸ் அண்ட் தென் க்ளோஸ் யுவர் மவுத். இது எல்லாத்தையும் க்ளோஸ் இட் அண்ட் தென் inhale, then exhale via nostrils. inhale nostril பண்ணிட்டு exhale nostril பண்ணும்போது with the mouthல நீங்க humming sound create பண்ண போறீங்க. So inhale, exhale க்கு while exhale you have to give a humming sound, that is called brahmari. இதுவும் start from 1 minute and then you can extend up to 3 minutes. இது வந்து ஈக்குவல் பிரீதிங். நெக்ஸ்ட் மூவிங் டு ஈக்குவல் பிரீதிங் ஆர் பாக்ஸ் பிரீதிங், சமவிருதி சொல்லுவாங்க. ஸோ சிட்டிங் பொசிஷன் யூ கேன் இந்த சமவிருதியில வந்து யூ கேன் அட்ஜஸ்ட் த கவுண்ட்ஸ். லைக் எப்படின்னா inhale for 4 seconds, hold your breath for 4 seconds, then exhale for 4 seconds, hold your breath for 4 seconds. இந்த 4 seconds பண்ண முடியலன்னா you can alter, you can adjust the counts. Like even for 2 seconds you can inhale, hold, then exhale 2 seconds, then hold for 2 seconds. இது வந்து ஈக்குவல் பிரீதிங் ஆர் பாக்ஸ் பிரீதிங் சொல்லுவாங்க, which is very beneficial for athletes, endurance and performance improve பண்றதுக்கு, then swimmers-க்கு, தென் ட்ரக்கிங் போறவங்களுக்கு, இவங்களுக்குலாம் அந்த பாக்ஸ் பிரீதிங் கண்டினியூஸா பண்ணும்போது லங் வால்யூம் அண்ட் கெப்பாசிட்டி, என்டியூரன்ஸ் எல்லாமே இம்ப்ரூவ் ஆகும். Then it is the final breathing technique, easy technique. I have chosen only very limited breathing technique. எப்படி உங்க கேபின்லயே நீங்க ஈஸியா பண்ணலாம், இல்ல எனி டைம் டேல பண்ணலான்ற மாதிரி தான் நான் சூஸ் பண்ணேன். Coming to the last technique, 4-7-8 breathing technique. Like 4 seconds you are going to inhale via nose, then hold your breath for 7 seconds, then exhale very slowly and extend up to 8 seconds. This is the final breathing technique. ஸோ இது எல்லாமே ரொம்ப சிம்பிள். ப்ராக்டிக்கலா நீங்க உங்க கேபின்ல இல்ல உங்க பேஷண்ட்ஸ்க்கு நீங்க சொல்லலாம். பிரீதிங் டெக்னிக்காவும் சொல்லலாம், இல்ல பிராணாயாமாகவும் டீச் பண்ணலாம். ஸோ ரெஃபரன்சஸ் ஐ ட்ரைடு டு அட்டாச் ஃபியூ ரெஃபரன்சஸ். பிராணாயாமாக்கு வந்து ரொம்ப சிக்னிஃபிகண்ட் ரிசர்ச் பேப்பர்ஸ் கிடையாது. பட் நம்மளோட டயஃப்ரமேட்டிக் பிரீதிங்க்கு, கிளாசோஃபரெஞ்சியல் பிரீதிங்க்கு, அப்புறம் பர்ஸ்லிப் பிரீதிங்க்குலாம் லாட்ஸ் ஆஃப் சயின்டிபிக் எவிடன்சஸே இருக்கு. Thank you so much for giving
excellent
this
presentation.
opportunity.
Excellent presentation, madam. Can you demonstrate any of this, or may demonstrate your breathing techniques, yoga technique, samvriti,
Yoga
brahmari,
techniques,
brahmari pranayama,
Samvriti,
nadisutta pranayama.
Brahmari,
Shall I
Nadisutta I will do.
demonstrate and
I will do. Yes sir, yes sir, you can sir, you can sir. You are the master and you can sir.
Oh, this is the time. The almost 37 viewers are there in our team. At least they can get benefited out of it. Shall I, Pradeep? Shall I
So please go ahead, sir. We are waiting, sir.
Yes, sir. Yes, sir.
Yeah.
You are the
I
master
said,
of pranayama.
yeah,
You can call
yeah.
it.
No, not at all a master. I'm a learner. See, first you said in the yoga, it is Kapalabhati Kriya. Kapalabhati Kriya, that's what you told. The first.
Yeah.
It is just clearing
Yes.
your nostrils. First thing is but for clearing nostril and clearing your first all toxic meeting outside. You can sit in the early morning. Just one hand is Chin Mudra, another hand in the Brahi Mudra. Just to blow out. This is how you have to do the Kapalabhati Kriya, where the lung capacity increased, there is clearance of your nostrils, clearance of your throat, and clearance of air passage inside. Next is Nadi Sutti Pranayama. You told Anuloma Viloma. Take a deep inhalation, keep it for 2 times, and then exhale. And without breathing 1 time. It is 2:1:2:1. Inhale through your left nostrils. Three times. Exhale through your right nostrils. Twice what you have retained inside. Gently, without any interruption. Then close both the nostrils. With the empty lungs, you have to keep for 2 times. Then repeat through the right nostrils. This is 1 cycle. Then Samvrti, same 4 seconds inhale, 4 seconds retain, 4 seconds exhale, and without breathing 4 seconds is Samvrti. And Brahmari Pranayama, just close your ear tightly, keep 1 finger above the eyebrow, 2 fingers closer to your eyes, and 1 finger in the angle of the mouth. Take a deep inhalation. Keep a Maharam sound. Maharam for your throat. This will give you full energy for the whole day. It is not, you will be 24 hours, you will be active when you do this Brahmari Pranayama. And any more, madam? And another is a Nadi Siddhi Pranayama, this deep inhalation, keep it for 4 times and exhale for 2 times and without breathing 1 time. And this is Vastrika Pranayama. This will give accessory muscles of respirations, healthy accessory muscles. Just blow out. This is how Vastrika Pranayama has to be done. If it is done in a right manner, I think you will the whole day is very fruitful to you and very active, and your lung capacity increase. You will not get your asthma or CPOD or something like that, any respiratory infection, and your mind get calmed down. You will not stress. I have demonstrated only for 4. There is till more is there. We'll see in the next time. Thank you. Thank you for giving me an opportunity to demonstrate.
Thank you for demonstrating, sir. Thank you for demonstrating us. Thank you so much, sir.
Thank you, sir. So, Keerthi ma'am has taken a great effort to present the science behind the breathing in a clear and structured way, ma'am. And your use of all these explanations shows your dedication, how important it is. And Doraikannan sir has stolen the spotlight from madam by her practical demonstrations.
Oh,
Thank
no,
you, sir.
Just add on her. She may be she is very expert. She may hesitate to show in front of us.
Yes, sir. So I invite Dr. Ibrahim sir to say a few notes about breathing, especially in athletes and in sports.
Yeah. Ibrahim sir. Ibrahim.
So, sir, I think he's busy. So, shall we we'll come back to him later? Sir, Ibrahim sir, you're there, sir?
Yes, sir. Yes, sir.
Good evening. Good evening. Ibrahim, breathing and athletes.
Yes, sir. Definitely, sir. Breathing is very important in almost all sports, and the technique has to be learned by everyone, not only our professionals, but also by patients preoperatively and this thing. So these techniques are very easy, and also we can follow it very easily in whatever place we are. Not only in a gym or in a playground, we can do wherever we are, in the room, in our clinic, in our operation theater, anywhere. So these techniques are very important because there is something called some parameter called VaO2. That is our how the body is utilizing our oxygen concentration more efficiently. That improves with these techniques. So in running this breathing techniques is very important. Along with strength training, this breathing techniques has to be implemented and included in our routine so that we improve our efficiency and run with less chances of injury. Thanks for the demonstration, sir.
Thank you, sir.
Thank you, sir.
So we're going to the final topic today. So it is by our Nandakumar, sir. He's going to be talking about nutrition and lifestyle choices and its impact on metabolic health. So we all know how active Nandakumar sir is. After finishing his MBBS and DCH, he has been a practicing pediatrician since 2003 in Trichy. He's a life member of IAP. He's active both in IMA and IAP. And he's been creating lifestyle awareness among doctors and public since 2018. Over to you, sir. I think you can start sharing your screen, sir.
Am I audible?
Yes, sir, you are, sir. The screen is visible also, sir.
It's visible now? Okay.
Yes.
Good evening, all of you. Very happy to meet you all on this pleasant Sunday evening. For the next 30 to 40 minutes, I'm going to discuss on the nutritional and lifestyle choices and its impact on metabolic health. So we all know, some of us will be knowing, have come across this word epigenetics. What is epigenetics? Epigenetics is nothing but the environmental and lifestyle choices we follow and how it's going to alter our gene expression without altering the underlying DNA sequence. In simple terms, the environmental choices, the food we consume, the social connections we make, whether we are living in indoors or outdoors, what kind of fitness routines we are following, what are the career options we are undergoing now, whether we are sleeping properly, and the relaxation techniques, whether we are following are correct, all this makes an impact on our gene expression. It's called as epigenetics. So more simpler terms, the genetics loads the gun, but the lifestyle pulls the trigger. So some of us will be having faulty genes which we get from our forefathers, but it doesn't mean that we have to undergo the complications because of the faulty genes we are carrying. But when we undergo the proper lifestyle and the food choices, we can avoid the complications, and the explosion will not happen, and the trigger will not be pulled. That is the most simple explanation. So many of us know, we have come across metabolic health. We have been discussing metabolic health. What is the definition for metabolic health? This is a very simple definition. What metabolic health means. Metabolic health can be defined by the following: lack of vascular dysfunction, that is normal BP, normal to high HDL levels, low triglyceride levels, low visceral fat, and insulin sensitivity. If all these parameters are there, we can define as a person is having a good metabolic health. So these are the 5 pillars of healthy lifestyle. Nutrition and diet plays an important role. Physical activity comes next, and sleep, which was described by Dr. Doraikannan sir very effectively, it plays an important role. Mental health and relaxation techniques, what Dr. Keerthi just now enumerated, it also plays a role. And the natural lifestyle we are undergoing, all those things plays an important role in giving a healthy lifestyle for us. So our forefathers, they were brought in an environment where there was food scarcity was present. Humans were subjected to intermittent bouts of feast and famine and constant physical activity. Early humans may have benefited by this because of this prioritizing storage of nutrients happens during the times of plenty, and when there is a need or famine is there, they will utilize those nutrients, and they may remain healthy. But in the present circumstances, there is a food surplus because of the agricultural revolution and all the commercialization happening. Many unwanted foods and fast foods and junk foods are being created, and the food engineers, they know by combining sugars and fats and salt, we can the taste buds are being stimulated, and we keep on children and other adults and young adolescents are into overeating because of the wrong commercial interests. So that is the reason for the obesity cropping up in our the world and the global, and also in India. Nearly 25 million Indians are obese or overweight, and the diabetic incidence in India, according to the current ICMR status, is around 77 million Indians are affected from diabetes. And also the world diabetic in the statistics shows that nearly 589 million adults are being affected with diabetes, and the current projection is by 2050 nearly 850 million global population will be suffering from diabetes. So it is very important for each and every one of us to know how to overcome this big burden. The world population, also in the Indian subcontinent, which is the capital of is the diabetic capital of the world, is going to face this big issue in the future. So for that, we should know how the metabolic pathways, what are the hormonal interplay of hormones takes place in our body, and what is the pathophysiology of fat storage that is responsible for obesity and diabetes. All these things we should be aware of. As physicians, we have a role to understand first. When we understand, then we can able to effectively treat the patients properly. So this is the 3 nutrient sensor pathways which works in our body. The 3 nutrient sensor pathways are the insulin pathway, mTOR pathway, and the AMPK pathway. For the insulin pathway, glucose is the stimulus. So the insulin pathway, majority of the times, we Indians, we eat 80% of our diet from carbohydrates. So 80% of the time we are stimulating this insulin pathway, which insulin pathway with the stimulus is glucose. So carbohydrates, when we consume it, when it goes into the body metabolized, it is the end molecule is glucose. So 80% of the diet we derive from glucose. So insulin pathway is majority of the times our body is overacting, and the mTOR pathway, it depends upon the amino acid pathway. That is the protein consumption we make. Unfortunately, we Indians, we are not taking enough proteins. There is a big lag protein in lag is intake is there. So the mTOR pathway is suboptimally is being activated in our body. Likewise, the AMPK pathway. AMPK pathway it's a pathway, very important pathway. It works in the long time. The AMPK pathway is activated when we are not eating food. The AMPK pathway is activated. For example, when you are following a intermittent fasting, when there is caloric restriction, and when you are doing proper exercise, physical activity, and when you are consuming omega-3 rich food, fatty acids, and when we are taking polyphenols, all those things will activate the AMPK pathway. So when we can upgrade our AMPK pathway, and we can upgrade our mTOR pathway, and we can downgrade our insulin pathway, it will do a big help in the longer run. This is the biochemical pathways which we should be aware of. And the very important concept is this glycemic index and the glycemic load. Glycemic index, we all know that when we consume a food, how quickly the blood sugar level rises. This is the glycemic index. Whereas the glycemic load is the amount of carbohydrate we consume. When we consume, it can produces a sugar spike over a period of time. That is called as glycemic load. So when we take food which is low in glycemic index and low in glycemic load, the insulin pathway is downregulated. So based upon the categorizing from 0 to 100, glycemic index can be categorized as low, medium, and high. Low glycemic index foods like fruits, vegetables, nuts, and non-vegetarian food, protein sources can be taken for low glycemic index foods. Medium, like example, brown rice is medium glycemic index, and high glycemic index foods like junk food, white rice, all the junk comes under high glycemic index food. Likewise, the glycemic load can also be categorized into low, medium, and high. So, putting into more simpler terms, glycemic index is like a petrol. Petrol burns quicker and faster. Say, or 1 liter of petrol, if we burn it, it burns quicker and faster. That is called as glycemic index. Glycemic load is a truckload of wood. Example, a truckload of wood is burnt. It burns very longer. Now it burns very long. It takes a long time for the wood to get burnt. So that is the difference between glycemic index and glycemic load. So when we consume a food, it should be low in glycemic index. That is the sharp sugar spikes should be avoided. At the same time, and the longer duration of blood spikes of sugar should not happen. That is the glycemic load. Amount of carbohydrate we consume should also be on the lower side. That is the glycemic index and glycemic load. So the response of insulin to food. So when you consume a food rich in carbohydrate, the higher insulin spike happens. If you see, the higher insulin spike happens when you consume a carbohydrate rich food. Where is the for a protein intake, the medium rise only take place, and for a fat intake, very very small rise of insulin spike happens. So coming to the interplay of hormones. So the 4 hormones which comes to my interest is this leptin, ghrelin, and insulin. We all know, just I told, and then the incretin hormones. So regarding all these hormones, I'm going to speak little bit about them. So we all know that the ghrelin is the hunger hormone. It is produced by the gastrointestinal tract. When we feel hungry, it means the ghrelin secretion is there, so that we tend to eat more food. So once we eat food, it contains adequate amount of proteins, fats, and all those things. The adipose tissue, the leptin secreted by the adipose tissue. So it sends a signal to the leptin sends a signal to the brain that I'm full, I'm feeling satiated, so that we stop eating. So this is a normal course, it happens. And also the food we consume, also if it has sufficient proteins and fats, the incretin hormones are secreted. The incretin hormones also give a signal to the insulin, so insulin is secreted. So these 4 hormones should work in tandem, so that our hunger should be subsided, and we should feel full. But when there is higher insulin secretion, when the insulin is over secreted, when there's hyperinsulin secretion, when we tend to eat more carbohydrate food, the signal to the brain by the leptin is cut off. This insulin will cut off the signal by the leptin to the brain. As a result of it, we tend to overeat, and we have more ghrelin secretion, and we'll become more obese and overweight. So the incretin hormones, the GIP and the GLP-1, these are the 2 incretin hormones. They generally stimulate the insulin secretions in response to nutrient intake. So GLP-1, what it does, it increases the insulin secretion, it decreases the glucagon secretion, and it decreases the gastric emptying, and also as a result of it, it decreases the food intake. So in diabetes, what happens? There will be decreased incretin hormone secretion in type 2 diabetes, and also in overweight persons. So as a result of this, there will be a subnormal insulin secretion. Because of the subnormal increase in the insulin secretion, the increased carbohydrate load, which causes increased triglyceride secretion by the liver. The liver converts all the glucose that enters into the body by converting it into triglyceride, and it stores either in the adipose tissue or in the fat in the liver. Some amount of skeletal like glycogen is also stored in the skeletal muscle. So when there is in a decreased incretin secretion, it results in a lot of metabolic issues and insulin resistance, and there is a decreased adiponectin and increased leptin levels happens. So this is the in response to food, how the GLP-1 hormone works. It is being displayed in this slide. So in response to carbohydrates, the GLP-1 hormone levels are secretion is low, while for fats, that is for example olive oil or butter, in this slide they have a robust secretion of GLP-1 hormones. Likewise, when we take a higher protein intake, the GLP-1 hormones are secrete in a better way. So this is the thing. And the glucagon like peptide, that is the GLP-1, that is the major drug that is being promoted by the world market. It produces the same effect. The same effect we can produce by consuming a proper food which is rich in proteins and complex carbohydrates and nuts, eggs, all those things. We can increase the GLP-1 levels by which may aid in managing diabetes and satiety. The GLP-1 drugs which they are promoting worldwide, very costly. Likewise, the Ozempic is the drug which is being marketed in the world market. It's very, very costly, but the same effect we can produce by eating the right food. So normally, if we eat only 3 meals, say breakfast, lunch, and dinner, only the 3 insulin spikes are there. Our body is made to only tolerate a maximum of 3 insulin spikes per day. But in the current circumstances, because of excessive food intake, not only we are consuming breakfast, lunch, and dinner, we also consuming a mid-morning snack, evening snack, and a late night snack. So every food we consume, it causes an insulin spike. So which the human body isn't adapted to handle. So we have this, we have to understand the pathophysiology of how the fat storage happens in our body. So we have 2 type of fat cells, adipocytes. That is, the adipocytes can undergo either hyperplasia or hypertrophy. Adipocytes hyperplasia is increase the number of fat cells. That is the hyperplasia. Increase in the size alone, that is called as hypertrophy. So we Indians are prone for hypertrophy. We cannot have that capacity to have an increase in the number of cells. We have the capacity only to increase in the size of the fat cells. That is hypertrophy. Indian population is prone for hypertrophy, Southeast Asians. On the other hand, the Caucasians, the European population, the Westerners, they have this type of phenotype, adipocyte hyperplasia phenotype. So they have the more capacity to hold fat in their body, but we have limited capacity only to store glucose as fat or triglycerides as fat inside the fat cells. So when we crosses this, when we exceed this capacity to hold fat, what happens? This spillage of fat from this hypertrophic fat cells happens. As a result of this, it causes chronic inflammation and visceral fat deposition. That is, the visceral fat deposition happens, and ectopic fat deposition happens, and it also inflammation of the coronaries happens. All those mismatch happens over the body. So this is a very important slide. We have to understand that we differ from Caucasians in this adipocyte characterization. So we all know about metabolic syndrome. Metabolic syndrome is a major issue currently we are facing now. It is only tip of the iceberg. Nearly nearly 1/3 of our population are either obese or overweight. One in three of our Indian population are overweight or obese, and will be silently carrying this metabolic syndrome in us. Because why metabolic syndrome is very important? It is the future stepping stone for the heart disease, dyslipidemia, hypertension, type 2 diabetes, cancer, dementia, PCODs, and non-alcoholic fatty liver disease. So metabolic syndrome is a very, very important entity. Every physician, every practitioner should be able to identify metabolic syndrome and to treat it properly, because it is going to be a future tsunami in the coming. So how to identify metabolic syndrome? For Asian Indians, this is the definition. For abdominal obesity in men, if it is more than 90 centimeter, and in women, if it is more than 80 centimeter, along with it, any two of these parameters are there, we call it as metabolic syndrome. The triglyceride levels are more than 150, or the HDL levels in men less than 40, or in women less than 50, or if the blood pressure is more than 130 by 85, or if the fasting blood glucose is more than 100, we call it as metabolic syndrome. So coming to the next one, the very serious issue is the fatty liver. So fatty liver, 1 in 4 Indian population adults are having fatty liver. So in fact, nearly 35% of are watching this program. Half of nearly 1/3 of us will be having fatty liver silently. If we go and test our liver scan, ultrasound abdomen, we'll be fine, we'll be having a fatty liver. So why fatty liver is very important? Because fat accumulation in liver with no inflammation, we call it as non-alcoholic fatty liver disease. If inflammation also happens, we call it as NASH, that is non-alcoholic steatohepatitis. Now the terminology they have modified into MASLD, that is metabolic dysfunction associated steatotic liver disease. So why this condition is important, why I am going to stress this more in this topic? Because liver is a very important organ. Liver is very important for our metabolism to happen, because liver plays multiple roles. Liver it can burn glucose, it can store glucose as glycogen, or it can produce from glucose, it can convert into triglycerides. It has multiple roles. If the liver fat accumulation happens in the liver, metabolism definitely is getting altered. We should be aware of it. So if the fatty liver is progressing, it may go in for hepatitis, inflammation, and later it may go for fibrosis and scarring, and it may end up with end-stage liver cirrhosis and hepatic liver cell failure. So up to this point, that is the hepatitis inflammation point, we can able to reverse through proper diet and lifestyle adjustments. We can revert to health original status. And also early stage of fibrosis also we can tackle them with proper life and food and lifestyle alterations. But once it goes beyond certain limit, we cannot save the liver. So each and every one of us should be able to handle fatty liver. We have to, as a routine, we have to do certain markers to understand whether the liver is functioning well. I can do an ultrasound abdomen. We can see that if the triglycerides are high, if there is abdominal obesity, we have to think in terms of liver fatty liver. So there is this latest, that is a liver scoring, that is a fibrosis FIB4 score screening is available. So we can enter the age, AST, that is the SGOT, SGPT levels, and the platelet count levels. So that using this formula, age into AST divided by platelets into square root of ALT, we can find out the range. If the range is less than 1.3, there is no problem. With 1.3 to 2.6, there is an intermediate, there is a range. This we have to be very careful. With more than 2.6, definitely there is a severity of fibrosis is happening, liver fibrosis is happening. So we have to do for further tests, liver scanning, and all those things that have to be done. MRI liver and elastography can be done to find out whether their liver problem is progressing. So we all know about this mitochondria from a textbook of school textbooks. We have learned biology classes. We have learned about mitochondria. Mitochondria are the powerhouses of the cell. They consume the food and the oxygen, and they create ATP. By using the electron transport chain and the Krebs cycle, ATP production takes place. So if we feed the body with the right food, ATP is generated, and good things will happen. When we eat unhealthy foods, and we experience too much of stress, so the ATP production will be not happen properly, and oxidative stress and reactive oxygen species will take place, and chronic inflammation, metabolic dysfunction, and mitochondrial dysfunction will happen. So coming to the thing, how we can design our own food truck. We understand that the current issue is we are not eating properly. Our food intake has been imbalanced, and we have a poor lifestyle. How we can design our food truck? Meal planning, we have to do it in a proper way, strategically, by organizing and preparing meals in advance. This reduces the reliance on unhealthy food options and encourages healthy eating patterns. A meal platter should have proper amount of vegetables, fruits, and 1/4 only should be grains. Grains should not be, our current consumption, we are 80% of a platter is filled with grains. We are not eating protein properly. We are not eating vegetables and fruits properly. Low sugar fruits can be consumed, and dairy products can also be consumed, so that there will be proper satiety, and the GLP hormones will be secreted properly, and our insulin will, there will be insulin secretion will be kept in a under check. So we have to start eating real food. This is the real food we should eat. The real food should have 9 essential amino acids. We all know that essential amino acids, which can be secreted only by our body. Our body cannot secrete it properly. We need from external sources. So essential amino acids are necessary for our hormone function, for our reproductive function, for our muscle growth, for bone growth, and for all the important immunological function, hemoglobin production, and for the skin and either organ function, all those things. So we should consume proper amino acids in our diet. We all know that our stomach pH is 1.5 to 2. Our stomach pH is between 1.5 to 3 is the normal stomach pH. In the gastrointestinal tract, our esophageal pH is around 6 to 7. Also, the duodenal pH is between 6 to 8. And why the nature has made the stomach pH to as so acidic? The stomach pH is between 1.5 to 3.5 is the stomach pH. Why nature has made the stomach pH so acidic? Not only for killing the viruses and the bacteria which enters our body, but also for protein digestion, we need proper acid. So the pepsin to pepsinogen conversion take place only if the hydrochloric acid is there in the stomach. If you are not having acid secretion in the stomach, the proteins cannot be digested. So when you are not eating protein properly, amino acids in food properly, so the acidity will be more, and it causes heartburns and reflux and other problems. So nature has indirectly telling us eat proper protein, so that's the reason why nature has made the stomach pH as so acidic range. So protein requirements per day is around 1 gram per kg per day for sedentary persons. So a person is weighing 75 kilos, which means he has to consume 75 grams of protein per day. So each platter should have at least 25 grams. So morning breakfast 25 grams, afternoon lunch 25 grams, night dinner 25 grams. Total 75 grams is covered. So we have to take proteins properly. So that is the normal protein intake, and we all know that protein we derive from all the vegetarian sources are there, dairy products are there, and nuts, seeds are there. And for non-vegetarian sources like eggs and chicken, fish, mutton, seafoods are there, and dal, all those things, legumes, we have protein sources. So let's make sure that we eat at least for every meal 25 grams of protein intake is a must, and it helps in making the insulin pathway to act in a lower way. If the insulin pathway is working in a higher way, then we are prone for more metabolic issues. Likewise, essential amino acids, omega-3 and omega-6, we have to take. Essential amino acids like like essential fatty acids, like essential amino acids, they cannot be prepared by our body. They cannot be metabolized. They cannot be secreted by our body. We need from external sources. So omega-3, we all know that marine sources and flax seeds, all those things have omega-3, and omega-6 we derive it from nuts and seeds, and all the oils and the vegetable oils, we get it from we get omega-6. This ratio of omega-3 to omega-6 should be 1:4. If we take one part of omega-3, we have to take 4 parts of omega-6. This is the normal ratio. Omega-3 is anti-inflammatory. Omega-6 is pro-inflammatory. So but the current food standards, we are consuming 1:20 is the ratio we are taking. If we are consuming one part, we are consuming 20 parts of omega-6. That is 1:20 is the current omega-6 amount we are consuming, which is on the very higher side. So we have to make till the balance towards omega-3. We have to consume more omega-3, and the omega-6 consumption should be made less. So healthy fats are all natural fats with only minimal processing, if any. So healthy fats like fatty fish, eggs, avocados, meat, butter, ghee, nuts, seeds, and olive oil can be consumed. So there is a big demonization going about fats. So they feel fats as unhealthy. It's going to cause heart attack. All those things. It's all bluff and it's a nonsense. And we have to we can have healthy fats without much fear. They are going to help us to. They'll improve the satiety. Like I have showed in my previous slides. The insulin response is the bare minimum to healthy fats. The highest insulin response takes place to carbohydrates, but for proteins and fats we have a very minimal response. Don't fear for fats, and we can it will improve the satiety, it increase the GLP secretions, all those things. And healthy fats are must for our healthy well-being. And coming to whole grains, like carbohydrates, that is the majority of our Indian diet is based on carbohydrates, because we are a very poor country. Economically we are not that great. That's why we are unable to consume more proteins and fats. So majority of our diet is derived from 80% of our diet is derived from carbohydrates. So because of carbohydrate, whole grains can be consumed, that's not a problem, with minimal amount. Say for example, those who have metabolic issues, metabolic dysfunction, they can have carbohydrates 25 grams per meal. They can consume, that's not going to harm them. But beyond that, it is going to trouble them, because 25% of our calories, if we can derive from carbohydrates, it's not going to create much impact. It will help us for, because to filling the calories and for taste and other things, we need some amount of carbohydrates, but it has to be limited. Those who have metabolic issues, obesity, diabetes, and all those issues, lifestyle diseases, they have to restrict the intake of grains. Let it be only 1/4 of the platter, which I showed earlier. 1/4 of the platter we can derive from grains. Complex carbohydrates are very important, because complex carbohydrates, which are available from the vegetables, low sugar fruits, and the greens, all those things are very important for our microbiota, gut microbiota. Our gut microbiota, they thrive on this complex carbohydrates. Complex carbohydrates are chewed by our gut microbiota, and they releases short chain fatty acids, which are necessary for very important role for anti-inflammation in our body. So the colonic bacteria, they thrive on this complex carbohydrates. The American Institute for Cancer Research it recommends 30 grams of dietary fiber each day as part of healthy eating pattern to lower cancer risk. The later AICR report, that is American Institute of Cancer Institute report, shows that each 10 grams increase in dietary fibers is linked with a 7% lower risk of colonic cancer. So this nutrition for gut health is very important. There are nearly more than 100 trillion microbiota. They are living in our intestine, that is a small and large intestine, and they thrive on this vegetables and fiber we consume. The human genome encodes around 23,000 genes, but the microbiota in our colon intestine, they they decode they encode more than 3 million genes. So we are more of a microbiome rather than human genome. That is the thing we have to understand. And if we feed them the right amount of food, they're going to help us. If we are consuming the wrong diet, then they'll act against us. So that is the thing. And the gut is innervated by the enteric nervous system. The enteric nervous system is connected to the brain by the vagus nerve. So there is a gut brain axis is functioning in our body. So the gut brain axis is very, very important. To maintain the gut brain axis, we need to take the proper balance of vegetables, greens, and fiber, which will this entering nervous system secretes neurotransmitters like serotonin, and they are very important for maintaining the mental health conditions, and they are helpful against stress, mood, and anxiety disorders. So this gut brain axis is a big topic. So we need to aware of it, and we have to protect our gut with the right amount of ingredients. And we understood that what type of food, essential amino acids, essential fatty acids, we have to eat, all those things, what to eat and what not to eat. But at the same time, we should know how to rest our body. This autophagy is a process in which the cell eats its own contents. So when a diseased cell or a diseased proteins in our body, it gets self-destructed by this process called autophagy. Autophagy happens when we undergo fasting. All religions in the world, they promote autophagy. The Japanese scientist got a Nobel Prize in 2016 for this concept autophagy, and there are multiple benefits of autophagy. So the intermittent fasting is the what thing we recommend for those with obese and for those who have severe metabolic issues, fatty liver, all those things. They will be benefited by doing intermittent fasting. What is intermittent fasting? That is to fast between night 8 p.m. to afternoon 12 p.m. So those who can undergo this 16 hours fasting, that is the feeding time is between afternoon 12 p.m. to night 8 p.m. The feeding time is 8 hours and the fasting time is 16 hours. So during the fasting time, they can consume water and low calorie drinks, all those things. But during the feeding time, they can consume protein rich diet and low carbs, enough fats, more vegetables, and water and herbal tea. All those things they can consume during the feeding time. So this is a very interesting concept, and it's giving very good results for those with fatty liver and for severe obesity and those who have severe metabolic issues. And the benefits of fasting are numerous. It not only it helps in weight loss, but also it helps in cancer prevention, type 2 diabetes reversal. It slows down the aging and reduces inflammation, decreases the insulin resistance. It boosts human growth hormone and gives better heart health, and better brain function. And it so many multiple good things it's doing. And regarding sleep, Dr. Doraikannan has already stressed a lot on this, so I don't want to further elaborate on it. And this circadian rhythm has to be maintained, because until 100 years back, we didn't had electricity. So electricity was invented only 100 years back. Before 100 years, we as humans, we went home by 6:30. When the sun sets, went home. We had a early dinner, and by 8 o'clock, most of our forefathers would have gone for sleep, and automatically by 5:30, when the sun they will get up and they will do their work, and they will continue. So the circadian rhythm was well maintained. But after the invention of electricity, this circadian rhythm has been distorted. Now, because of bright LED lights, all those things, we are awake until 12 o'clock, and because of Netflix and other movies available, we go to sleep by 2 o'clock. So obviously, our circadian rhythm is affected, our melatonin secretion is affected. As a result of this, there is an increased cortisol secretion and insulin resistance, and we tend to overeat. We eat at night also. So metabolism is altered. And these are the risks of sleep deprivation. If you are not sleeping properly, there is a risk of infertility, weakened immune system, risk of diabetes, obesity, increased blood pressure, risk of Alzheimer's, risk of cancer, and risk of heart diseases. So coming to this, vitamin D3 is a very important hormone. This hormone is called the sunshine hormone. When we are exposed to sunlight, but particularly between the daytime, in the 11 to 4 p.m., we get this vitamin D hormone secreted. But majority of Indians are deficient in vitamin D3. Nearly 60% of our population we have the vitamin resistant genes. So we need to check our vitamin D levels, and if it is low, we have to take a loading dose, and we have to take maintenance. I am taking a maintenance dose regularly. When I checked my vitamin D levels, I was shocked that it was in single digit, 5 or something 7. I have to take a loading dose, and I'm regular. I'm taking vitamin D supplements daily. So vitamin D is an important hormone. It improves the immune system, and it also helps in insulin sensitivity, heart health, protection against cancer, and a lot of many things vitamin D is doing. So stress relieving techniques, yoga and meditation, and Dr. Keerthi has elaborated a lot about the pranayama breathing exercise, because it activates the parasympathetic system, and it gives a lot of calmness and well-being to us, and we need to practice these stress relieving techniques. And physical activity, it's a very, very, very important area, and a lot of good speakers have elaborated on this topic. 60 minutes of physical activity is a must for all of us, and exercise has multiple roles to play, because it improves the metabolic flexibility, metabolic function. It improves the mitochondrial function, and also it improves the insulin sensitivity and also it promotes autophagy. And this type 2A muscle fibers has to be activated by doing resistant exercise, by which causes both oxidative and aerobic and anaerobic metabolism. It improves the type 2A fibers, and type 2A fibers are necessary for increasing the mitochondrial density, beta oxidation, and many other things, and also increases the BDNF levels in the brain, neurogenesis, and our learning and memory becomes improves by doing resistance training and exercises. So telomeres are nothing but cap-like organisms at the end of chromosomes. This pink cap-like organisms structures at the end of chromosomes called as telomeres. The research found out that telomeric length increases when we do exercises, when we do meditation, when we consume vitamin D, omega-3, all those things extends our telomeric length. When there are no more telomeres are no more, telomeres are there, it means that we are going to die. So telomeres increases with all these important aspects which I have mentioned. So this is the thing. And regarding epigenetics, I started my presentation with this word epigenetics. What is epigenetics? I told the environmental and the lifestyle aspects, whether it is nutrition factors, whether it is caloric restriction, whether this exercise or environmental good environment we are living, and the emotional health we are practicing. All those things play a very, very important role in disease prevention, and we can manage our we can avoid complications by practicing this epigenetic model. And this is a very good book written by Dr. Peter Attia. He is one of my inspiration. This book, Science and Art of Longevity, is a very good book. I recommend for all of you. You can it is available as PDF, and also in soft copy is available. So 4 things you can do every day to keep your brain sharp, joyful, and energized. Eat protein-rich diet with good healthy fats and slow carbs. Stop poisoning your brain by avoiding social media and consuming too much sugars and refined carbohydrates. Move your body, relax, and calm the mind. Thanks for the patient hearing, and this comes to the end of my presentation. Thank you very much.
Very beautiful presentations. Actually, each and every slide shows how much pain and effort you have taken to collate this beautiful topic, sir. So we have a few doubts asked, sir. I think we can answer that, sir.
Definitely.
Shivakumar sir is asked whether fat and protein secrete more incretin than carbohydrates. Is this correct?
What is this? Fat and protein?
Secrete more incretin.
Yes, definitely. Incretin hormones are increased when we consume more proteins and fats. That is the thing. When you consume carbohydrates, the incretin secretion is very, very minimal. So that is the thing. Proteins and fats, it is helpful.
So Dr. Rekha madam is asking if there is a good detox morning drink. Do we need such a drink, sir? Actually, your opinion about that?
We can take non-caloric drink. We can consume, because I discourage this bed coffee method, the bed coffee, all those things. Overnight 12 hours fasting. We every one of us should do it. So, for example, morning, night 8 or 7:30, we are 8 o'clock. We are finishing our dinner until morning. Next morning 7:30, 8 o'clock. We should not take anything. We should consume only non-caloric drink like water and black tea or something we can take. But if you add some sugar into it, it becomes a caloric drink. So non-caloric drink we can consume, nothing wrong in it. But on the overnight, at least 12 hours fasting, it definitely helps. If we can postpone it for 16 hours, 14 hours, 16 hours, it makes a lot of good thing. But at least 12 hours we can maintain the overnight fasting, and non-caloric drink can be consumed. That's the
What
thing.
about
I
the
think we can
diabetic
invite
patient?
Shivakumar sir to give his comments, sir. The guru
Definitely.
of time restricted eating.
Definitely.
Shivakumar, sir.
So, good morning, everyone.
Good evening, sir.
I'm audible.
Yes, sir.
Yes,
You
sir,
are
you are
audible,
audible.
sir. Audible, sir.
What is the doubt, sir? எனக்கு புரியல எனக்கு.
Sir, there is a question on detox drink. What is your opinion, sir? Nandakumar sir has said that any non-sweet added drink is okay.
Yeah, we don't need a specific detox drink actually, because if you restrict your carbohydrates, especially the simple sugars in your whole day diet, that itself will do the detox for the liver. Because if you consume more glucose and more fructose, that is going to give you more work to the liver, and the liver will not do other works. Because the main job of the liver is to detox the body. But if you put more carbohydrate, especially more fructose, because the fructose directly goes from intestines to the liver through the portal circulation, that is converted into fatty liver. So once you have a fatty liver through fructose, your liver will not do the detox work. See, if you put some fructose in your food throughout the day and you make your liver as a fatty liver, and then if you drink anything to detox that, it cannot be done. So no fructose is the best detox drink throughout the day. And you have to reduce your glucose, because excess glucose can be converted into fructose through the polyol pathway. So that again can be deposited in the liver. At least the excess glucose can be utilized by the body in the form of energy, but the fructose cannot be utilized in the form of energy by the body. The fructose is the only enemy. If you consume more fructose in any form, that is going to produce fatty liver. Then you cannot detox the liver by drinking anything. So I don't think you need any special detox drink. That's a myth. If you allow the liver to work on its own, that will do the detox by not consuming fructose, number one, by consuming limited glucose.
Can you enumerate certain fructose foods, sir?
Anything sweet in the mouth, that's called fructose. Because if it doesn't have a sweet taste in any food, that will not have a fructose.
Again,
Very
all
simple.
the-
When you put anything in the mouth, if you feel sweet taste, that will have a fructose. Very simple
Doctor,
test. You need not to go through the Google, you need not to remember anything.
Example of fructose-rich foods.
What's that?
Sir, all the sugary fruits have fructose, sir. Whether it is
All the fruits.
mangoes, whether it is banana, jackfruit, all the high sugar fruits, they have fructose in it. The current recommendation by pediatric endocrinologists is we can consume at the max 25 to 30 grams of fructose per day. That is the liver, which our liver can handle. Beyond that, the liver is going to convert them into fatty liver by de novo lipogenesis. That is the pathway. So the liver converts them directly into fat. So maximum recommendation is 25 grams of fructose we can consume per day. That is fruits we can consume. Say, for example, a cup of you are taking papaya, or half a cup of papaya we can consume. That's not going to harm it. It's not going to harm. When you are consuming more, say, or a few pieces of mango during the season, it's not going to harm. But you one full mango if you're cutting and one person consuming the whole mangoes, definitely it's going to harm. So that is the thing we have to understand. And when the liver is not functioning properly, which means that we have increased triglycerides in the blood levels, and there is a fatty liver, liver is indirectly telling that I am not doing well. Why are you giving more sugar? So in that case, definitely those who have metabolic issues, those who have problems, definitely they should decrease the intake of fruits, particularly high sugar fruits. They can take low sugar fruits like avocado or berries, strawberry, blueberry, and all those things, Indian gooseberry, those things, they don't have much fructose in it. They're not going to cause harm. But the high sugar fruits like mangoes, bananas, and jackfruits, and all the other sweetened sapota, like that, those fruits, definitely they're going to cause harm. They can be taken in very limited amounts, not much. That's what my understanding.
So Dr. Anand has also asked the same question, sir. You have answered that, fruit consumption. And one more doubt by Dr. Jayanti Mala. Is there any relationship between homocysteine levels and cardiac conditions?
Definitely there is some correlation is there. I'm not very experienced to talk about it. I'm not a cardiologist, but there is a correlation is there. Definitely.
So if there are any other doubts, I think you can unmute yourself and ask them. The scientific session is over.
Sir, any low fructose fruits that is available in India, that is other than butter fruit, you told?
Low fructose fruits, அதான் பாஸ் இது கோவா is there.
கொய்யா பழமா சார்? இஸ் a myth going on. கொய்யாக்காய் is better than கொய்யா பழம்.
கொய்யாக்காய் தான் சார். ரொம்ப பழமா சாப்பிடக்கூடாது, கொஞ்சம் கொஞ்சம் இதா இருக்க மாதிரி. ஆமா, இது பண்ணா சாப்பிட்டுக்கலாம் சார். கொய்யா is a very very economical fruit. Everyone can get it. கொய்யாக்காய், then நெல்லிக்காய், Indian gooseberry, நெல்லிக்காய். ஆமா, they are the very important. அவகேடோ இப்ப எல்லா இடத்துலயும் கிடைக்குது, கொஞ்சம் little bit costly, but very good fruit. And berries தான் கிடைக்குது சார். ஸ்ட்ராபெரியும் எல்லா இடத்துலயும் கிடைக்குது, கொஞ்சம் காஸ்ட்லி, அதெல்லாம் காஸ்ட்லியா இருக்கு. Strawberries are there, and that's what I can suggest.
Okay sir, thank you sir. Thank you sir.
Fat measurement meters, visceral fat, subcutaneous fat, அது மாதிரி அதெல்லாம் ஏதாவது யூஸ்ஃபுல்லா சார்?
என்னங்க சார், புரியல, திருப்பி கேளுங்க சார், நீங்க கேட்டது சரியா கேட்கல. விசரல் ஃபேட்? ஹலோ
சார், உங்க ஆடியோ பிரேக் ஆயிடுச்சு சார். நீங்க அந்த क्वेश्चனை திரும்ப கேக்குறீங்களா சார்? சுகுமார் சார்.
ஆமா சார். நம்ம இது ஃபேட் மெஷர் பண்றதுக்கு மீட்டர்ஸ் அவைலபிளா இருக்குல்ல, இந்த ஈரோட்ல கூட நீங்க போட்டிருந்தீங்க இந்த விசரல் ஃபேட் மெஷர்மெண்ட் மீட்டர்ஸ்லாம்.
ஹலோ பத்தி கேக்குறாங்க சார்.
சார் நான் வந்து எக்ஸ்பிளைன் பண்றேன் சார். நான் டாக்டர் இப்ராஹிம். ஸோ சார் என்ன கேட்குறாங்கன்னா, நம்ம இந்த ஈரோடு கான்ஃபரன்ஸ்ல, நலம்தான கான்ஃபரன்ஸ்ல இந்த வெயிட் மெஷர்மெண்ட்டோட சேர்த்து நம்ம இந்த விசரல் பாடி ஃபேட் மெஷர்மெண்ட்லாம் வச்சிருந்தோம். அதெல்லாம் ரிலேபிளா, அதெல்லாம் யூஸ்ஃபுல்லா, அதெல்லாம் வாங்கலாமா அப்படிங்கறதான் கேட்குறாங்க. அதை பத்தி உள்ள ஒப்பீனியன் சார்.
சார், I have no idea about it sir. I am not using it. I use simple measurements. நான் வந்து
டெஸ்ட் பண்ணாலே போறோம், ட்ரைக்ளிசரைட் அந்த மாதிரி.
ட்ரைக்ளிசரைட்ஸ் பார்க்கறேன், அப்டாமினல் சர்க்கம்ஃபரன்ஸ் பார்க்கறேன், அந்த waist and hip measurement பார்க்கறேன். இத வச்சு I am able to tell. பட் அதெல்லாம் கொஞ்சம் ஹை இது. நம்ம if you are able to spend for it, we can do it. But I am not using it on a regular basis. Using them.
Can I add some points, sir? Hello.
Please sir, go ahead sir. Go ahead sir, please.
Sir, regarding low glycemic Indian fruits பாத்தீங்கன்னா, நாவல் பழம் அண்ட் இளந்த பழம், இது ரெண்டும் வந்துட்டு சின்ன சின்ன ஃப்ரூட்ஸா இருக்கும். நீங்க வாயில போட்டு அதை மென்று சாப்பிடும்போது ரொம்ப சாப்பிட முடியாது, கிளைசமிக் லோடு வராது. அதுல வந்துட்டு ஒரு புளிப்பு டேஸ்ட், தோற்பு டேஸ்ட் தான் இருக்கும், அது இனிப்பு டேஸ்ட் இருக்காது. அதனால வந்துட்டு நாவல் பழம், இளந்த பழம், நம்ம இந்த ஸ்ட்ராபெரி, ப்ளூபெரிக்கு பதிலாக இது சாப்பிடலாம் சார். அந்த பெரிஸ்லயே வந்துட்டு ப்ளூபெரி வந்து ரொம்ப ஸ்வீட்டா இருக்கும், ஸ்ட்ராபெரி வந்துட்டு பிளாக்பெரி வந்துட்டு ரொம்ப ஸ்வீட்டா இருக்கும், ப்ளூபெரியும் ஸ்வீட்டா இருக்கும், ஸ்ட்ராபெரி மட்டும்தான் கொஞ்சம் புளிப்பா இருக்கும். அதனால தான் நான் என்ன சொல்றேன்னா, நம்ம இந்த மாதிரி பேர்லாம் ஞாபகம் வச்சுக்க வேண்டிய அவசியமே இல்லை சார். எந்த ஃப்ரூட்ஸ் நீங்கள் வாயில் போட்டாலும் கொஞ்சம் புளிப்பு கொஞ்சம் துவர்ப்பு இருக்குது, ஸ்வீட் டேஸ்ட் அதிகமாக இல்லை அப்படின்னு சொன்னால் அதில் ஃப்ரக்டோஸ் கம்மியாக இருக்குது. பிகாஸ் இட் ஷுட் பி ஈஸி டு அண்டர்ஸ்டாண்டாக இருக்கணும், நமக்கு ப்ராக்டிக்கலாக இருக்கணும். நிறையா பேர் ஞாபகம் வச்சுக்க வேண்டிய அவசியமே இல்லை. இப்போ கொய்யா பழத்தை வாயில் போட்டிங்கன்னா இனிக்கும், கொய்யா காயை வாயில் போட்டிங்கன்னா இனிக்காது. அப்போது அந்த ஸ்வீட் டேஸ்ட்டு அப்படின்றது வந்து இட் கம்ஸ் ஃப்ரம் ஒன்லி ஃப்ரக்டோஸ். த குளுக்கோஸ் அலோன் வில் நாட் கிவ் யூ ஸ்வீட் டேஸ்ட்டு. அதனால் ஃப்ரக்டோஸ் நீங்கள் கம்மியாக சாப்பிட்ணுன்னு நினச்சா வாயில் போட்டு பார்த்துட்டு ஸ்வீட்டு கம்மியாக இருந்தால் சாப்பிடுங்க, அவ்வளோதான். ரொம்ப சிம்பிள். நம்பர் 1, regarding 40 visceral fat, there is no absolute correct method to measure or any imaging tool to get the visceral fat exact amount. அது கண்டிப்பாக கிடையவே கிடையாது. எல்லாமே வந்துட்டு இன்டைரக்ட் கால்குலேஷன் மெத்தட் தான் இருக்குது. அதில் நீங்கள் வந்துட்டு நம்பர் 1 ஃபேட்டுக்கு வந்துட்டு கோல்ட் ஸ்டாண்டர்ட்னா டெக்ஸா ஸ்கேன் ஆஃப் த ஹோல் பாடி. அதுலேயுமே யூ கேனாட் கெட் அ விசரல் ஃபேட் செப்பரேட்டாக பண்ணவே முடியாது. டோட்டல் பாடி ஃபேட் பர்சன்டேஜ் மட்டும்தான் உங்களுக்கு அதில் கிடைக்குமே ஒழிய விசரல் ஃபேட் அதில் கிடைக்காது. நம்பர் 1. நம்பர் 2, அந்த இன்பாடி மெஷர்மெண்ட், அந்த அந்த ஈரோட்டில் பார்த்த மெஷர்மெண்ட், இது எல்லாமே வந்துட்டு இட் இஸ் பேஸ்ட் ஆன் that the machine can only differentiate between fat and non-fat, because non-fat component the electricity will pass through, fat component electricity will not pass through, low level of electricity. அதை பேஸ் பண்ணி that can give you fat mass, non-fat mass, அவ்வளோதான் பண்ண முடியுமே ஒளி. அதால் வந்து இந்த பர்சன்டேஜ்லாம் கொடுக்கவே முடியாது, மெஷர்மெண்ட்டில் கொடுக்க முடியாது. பட் there is some formulas to calculate and show you some visceral fat, but that's not exactly visceral fat measurement. எனக்கு தெரிஞ்சு விசரல் ஃபேட்டை வந்து எக்ஸாக்டாக மெஷர் பண்ணுறதுக்கு எந்த மெத்தடும் இருக்கிற மாதிரி தெரியல. ஸோ அந்த மெஷினில் கொடுக்கறது வந்து ஒரு அப்ராக்சிமேட் எஸ்டிமேஷன், சம் கால்குலேஷன். எனி திங் யூ கெட் இட் ஃப்ரம் த கால்குலேஷன், தட் இஸ் நாட் த அப்சல்யூட் மெஷர்மெண்ட். அதுக்கு நம்ம அவ்வளோ இம்பார்ட்டன்ஸ் கொடுக்க தேவையில்லை. பட் நந்தா சொன்ன மாதிரி அந்த ஹிப் வெயிட் ஹிப் ரேஷியோ அல்ல வேஸ்ட் ஹிப் ரேஷியோ அண்ட் தென் வேஸ்ட் ஹைட் ரேஷியோ, அந்த ரெண்டுமே வந்து ரொம்ப ரொம்ப ப்ராப்பர் இண்டிகேட்டர். அது சிம்பிளாக அது மட்டுமே நமக்கு போதுமானது. அது வந்து மேல் வந்துட்டு should be less than 0.9, ஃபீமேல் less than 0.85. அந்த that is a very simple, that is easy, that is can be done at any time. எனக்கு தெரிஞ்சு மற்ற எல்லாத்த விட இதுதான் வந்துட்டு ஒரு ப்ராப்பர் இண்டிகேட்டர். அதனால வந்துட்டு எக்ஸாக்ட் விசரல் ஃபேட் பர்சன்டேஜை கால்குலேட் பண்ணவே மெஷர் பண்ண முடியாது. We can get some calculations, sir. Is it clear, sir? Visceral fat and low glycemic fruit.
Correct, sir. Super.
So if there are no more questions, we'll ask our chairperson, Dr. Doraikannan sir, to give his closing remarks.
Thank you, sir. The excellent presentation today by 3 of the persons, including me. This Nandakumar has top in the list, as has done a research work and presented the same thing, as to take more pain for the past 15 days and get this all these slides done. I thank you very much. And in spite of a busy schedule, all 34 people attended this meeting. It is a great thing at a short notice. And we appreciate Pradeep for his excellent work in spite of his busy schedule in the meetings and his family commitments. So I thank everybody for attending. We'll meet again tomorrow in the next month. We'll plan a next every month. We'll plan a meeting, and it should be different, usually useful for the public also. We can get more persons to attend this meeting to get benefited. So thank you very much.
Thank you, sir. Thank you.
Thank you, sir. Thank you, sir. Thank you for giving me this opportunity, sir. Thank you, sir. Thanks, sir.
Thank you, sir. Thank you for giving us the opportunity. And the sir presentation was superb.
Thank you, madam.
Yes, sir. அது போன டைம் அந்த இதுல சென்னையில பார்த்ததை விட இன்னும் அழகு ஏத்திருக்கீங்களே சார். எப்படி சார்? ரொம்ப நல்லா இருந்தது சார். Each slide is really good. ரொம்ப நல்லா பண்ணிருக்கீங்க.
Thank you, sir. Thank you, sir.
So, and we'll continue the discussion in the WhatsApp groups. You can just message my number in case you're not in the group, and we'll add you there.
Okay, sir.
Thank you, sir.
Thank you, sir.
Have a good Sunday, nice Sunday. Thank you all.
Thank you, sir.
Thank you, sir. Thank you.